Adverse drug reaction monitoring and reporting. Myself, Professor M.U.R. Naidu. The presentation outline of this video is like this. Number one, history and rationale of safety monitoring during clinical trial. Number two, goal of safety surveillance in clinical trial. Number three, definition of various terms used in the topic. Then, what are the timelines as per regulatory requirement for reporting adverse event and serious adverse event? Investigator responsibility. Safety surveillance activities. Number seven, conclusion. The importance of timely reporting. Coming to history, drug safety is not a recent concept. Indeed, the ancient Greek supported the notion that the physician who poisons his patient should have his hands cut off. It is only in the last 2 centuries, after a series of disasters, that the deliberate effort developed by product medicine and that were not only effective but also safe. Continuing the history, number one, the concept of drug-induced toxicity has been accepted since 19th century, and notably example included elixir chloroform anesthesia and sudden death which occurred in 1877. Then there is a death due to sulfonamide. It happened in 1937. The latter led to the enactment of Federal Drug Food Cosmetic Act 1938 in United States. The thalidomide incidents in the year 1960 resulted in major outcry about the regulatory requirement about the adverse event. Establishment of drug regulatory mechanism today, which requires new drug to be licensed by well-established regulatory authorities before being introduced into the clinical use for the patients. License medicine withdrawal. Between 1961 to 1994, as many as 131 products were withdrawn for various market reasons related to their safety. Number two example is fenfluramide, phentermine for pulmonary hypertension. Terfenadine and cisapride were withdrawn because of potential cardiac arrhythmias. The life cycle of a medical product is influenced by its safety profile. If safety profile is poor, then the withdrawal of the drug will be very, very quick. Rationale of drug safety surveillance in clinical trial. The first is the Declaration of Helsinki. Every medical research involving human subject should be preceded by careful assessment of predictable risk and burden in comparison with the foreseeable benefit to the trial participant and others. Medical research involving human participants should only be conducted if the importance of the objective outweighs the inherent risk and burden to the subject. What is the impact of this thing on public health? ADR are sixth largest cause of mortality in United States. 16% of hospital admission in UK is due to the adverse drug reaction. What are the economical consequences? Some countries spend up to 15 to 20% of their hospital budget dealing with drug complication. Direct cost of managing drug-related morbidity mortality in ambulatory setting is US dollars 76.6 billion per year. What is the safety surveillance? The detection, medical management, and reporting of adverse event associated with an investigational product in accordance with the protocol and in compliance with GCP and applicable to the regulatory requirement. It plays a key role in clinical trial. Adverse events are collected during clinical trial to protect the safety of the participant in clinical trial. Through appropriate modification of the study protocol, improvement in study design and procedure, and if necessary, termination of the participant involvement or even termination of the trial. Improve understanding of overall safety profile of product. Evaluate the benefit and risk of the drug. Provide information for package insert if a drug is marketed. And lastly, comply with the regulatory requirement. Few terminologies are very important to understand. Now we don't use the word side effect, we use the word adverse event. There is a serious adverse event that is known as SAE, adverse drug reaction, ADR, unexpected unlabeled adverse event. Coming to adverse event ICH E6 1.2, any unwanted, untoward, unfavorable medical occurrence in the study participant is known as adverse event that develops or worsens during or after administration of investigational product. This is known as a temporal relationship, but may not necessarily have a causal relationship with its treatment. Adverse event can be physical sign and symptom or abnormal laboratory values, changes in the vital signs, physical examination, or an electrocardiogram. An increase in the frequency and intensity of the condition or illness that was present before study enrollment is also included as adverse event. Complication from surgery or procedure. If there is any doubt whether an event constitutes an adverse event, it should be treated as such. Subset of adverse event includes all adverse events are there, then adverse drug reaction, serious adverse event, unexpected adverse event. Coming to serious adverse event, as per ICH 1.50, an adverse event becomes serious when it results in death of the participant. Number two, if life-threatening, subject to immediate risk of death from the reaction as it occurred like anaphylactic shock, result in patient hospitalization or prolongation of existing hospitalization is also considered as a serious adverse event. Result in persistent or significant disability or incapability or disturbance of subject's ability to carry out normal life functions like amputation of leg is also serious adverse event. It is congenital anomaly or birth defect develops that is considered as a serious adverse event. If any other important medical events based upon appropriate medical judgment that may jeopardize the subject or may require medical or surgical intervention to prevent or avert one of the outcomes listed above is serious adverse event. Example is intensive treatment in emergency room or at home for allergic bronchospasm. Serious versus severe. Seriousness the serves as a guide for defining regulatory reporting obligation based upon event outcome. Severity describe the intensity of the event like mild, moderate, or severe. A severe headache may not be serious. A mild stroke resulting in disability may be serious. ADR as per ICH E6 1.1, noxious or unintended response to a drug, that is anaphylactic shock, swelling of the conjunctiva or hives. These all are actually known as a adverse drug reaction. Pre-approved product at any dose, marketed product at any intended dosage, response is equal to relationship cannot be ruled out. An ADR is an injury resulting from medical intervention related to the drug. Adverse drug reaction, adverse event plus positive causal relationship is known as adverse drug reaction. Adverse event versus ADR. Adverse event, there's a traffic accident caused hospitalization, the evidence of drowsiness is ruled out is adverse event. Trial subject injured during a robbery. Raised in blood pressure because patient forget to take his usual antihypertensive medication. Event after consent but before study drug is given. Adverse drug reaction, nausea after drug administration, bradycardia after beta blocker, immediate anaphylactic reaction, Raised BP or drop in BP after study drug is stopped but recur when the drug is reintroduced. Unexpected adverse drug reaction. An unexpected adverse drug reaction is one the nature or severity of which is not consistent with the information in the applicable product information in clinical trial. This is generally referred as a investigation voucher. An expected adverse effect is one previously observed and documented, not on the basis of what might be anticipated from pharmacological property of a medicinal product. Unexpected drug reaction example are acute renal failure in labeled adverse event. Interstitial nephritis is not. Patients with acute renal failure with subsequent new report of interstitial nephritis is included. Interstitial nephritis is an unexpected adverse event. All adverse event, adverse drug reaction, serious adverse event, unexpected, all are actually ADR represent new safety information. Unexpected CDR or ADR are used to update future version of investigator brochure. Timeline for reporting as SAE and AE is very important. This is regulatory requirement. Adverse event or serious adverse event standard timeline for reporting of this SAE unless otherwise specified in the protocol. Informed consent is signed. Run-in period. First, the investigation product dose was taken. Last investigator product dose was taken and follow-up period in reporting. So the adverse event starts from the individual who signed the informed consent and during entire period of the clinical trial and during the follow-up and subsequently also it is there. This is a delayed adverse event. Now coming to one very important issue is the blind breaking when the safety of drug is very much doubtful. Do not break the blind unless identify of the medication is required to treat or the trial participant. Contact the sponsor before breaking the blind. Blind should preferably be broken by the sponsor. If you do break the blind document, you have to mention who, what, when and why it was done. Casualty evaluation for all blinded adverse event should be made before blind breaking. Assume subject received active drug when evaluating casualty. What is the investigator responsibility as far adverse event is concerned? Elicit adverse event, serious adverse event during trial participant visit. Ask a standard non-leading question. Do you feel difference in any way since starting a new treatment or last visit? This question will be put to trial participant in his or her own language at each study visit. Report serious adverse event immediately to the sponsor. Notify ethics committee at the site of such serious adverse event as well as safety issue in letter received from sponsor. Sponsor responsibility expedited in reporting of all serious unexpected ADR to all concerned investigator, regulatory authority and ethics committee. Periodic submission of all safety updates to regulatory authorities. Expedited reporting. It is the sponsor's responsibility to inform the regulator of certain alarming ADR for post-marketing drug, fatal or life-threatening situation within 7 calendar days, serious unexpected within 15 calendar days. For pre-marketing drug, all SAE within 7 calendar days. Summary: expedited reporting. Trial participant complains of adverse event after taking the investigational product. As soon as possible, investigators should assess whether the SAE is serious or related to investigational product. Within 24 hours, the investigator has to report serious adverse event to sponsor and to ethics committee. And within 7 to 15 days, prompt review and the action to be taken by sponsor and regulatory authority. Role of investigator: patient safety, study investigator, sponsor, and regulatory authority. So, investigator, sponsor, as well as the regulatory authority, all are actually responsible for patient safety related to the adverse drug reaction. Actions: modification of trial protocol or discontinuation of the trial, further investigation in adverse event, label change of the product withdrawn from the market. So these are the action will be taken once it is confirmed and find out with the regulatory authorities. Thank you very much for the video presentation.